Hello, kidney warriors. James here from Dadvice TV, your online kidney health coach, and this is another episode of Dadvice TV Live. Now tonight, for the next half an hour, we are going to do something very special that we did last month. We're going to make this a regular thing. We've got your guys' favorite renal dietitian sitting right over there in the green room. We're going to bring her out here and we're going to answer your questions. You got questions about diet. You got questions about, certain foods. We've got you. We're going to take care of it. You're going to feel great and empowered by the end of this half-hour broadcast. So let's go ahead and let's jump right in. Please give a giant warm welcome. You guys know her. You guys love her. Jen Hernandez of PlantPoweredKidneys.com. Hey, Jen.
Hi, James. Hi, everybody. I was just putting it up on Facebook like, oh, yeah, join us right now. I am so excited to be back here. Always last minute. But I am very excited to be back, and I am very excited for your questions that you have for us tonight. In case you don't know who I am, my name is Jen Hernandez. I am the founder and registered renal dietitian behind Plant Powered Kidneys. So I have spent the majority of my dietitian career helping people in all stages of kidney disease. And I spent a lot of my time working in the dialysis clinics, but I wanted to help people prevent that from happening and to address kidney disease earlier on, particularly by making really healthy and smart nutrition changes. And that's what we focus on at Plant Powered Kidneys. So if you want to learn more about us, if you want to learn about our course or working with our dietitians or get a ton of the free content we have on our website, you can find us at plantpoweredkidneys.com. Or if you're looking for more support, you can find our Facebook group on Facebook. Look for Plant Powered Kidneys, and you can join our free and private group to join thousands of other people that are wanting to include more plants in their diet that still protect their kidney function.
Yeah. So everyone out there, if you got questions, post them right there in the comments. I want to say hi to Estelle. See, Estelle, this is live. Isn't that cool? Now, while we're waiting for people to post questions, I have a couple to get us started for you, Jen.
Love it.
Is there one diet that kidney patients need to follow? Like, hey, here's the food to eat this list and you're all good?
Yeah, old school, old thought was yes, there is a renal diet and there's all these things to avoid. But what we know now is that even for different stages of kidney disease, different causes of kidney disease, and different people, we are individuals with our own nutritional needs. There is no one size fits all renal diet. And what may work or not work for one person doesn't mean that's going to be the case for another person. I was actually just talking with a group of our students today about adding animal protein into their diet and tips on if that's something they want to do, what we'd look at to help make that a smart choice that still fits their own nutrition parameters. So we really need to step away from this idea that, oh, because so-and-so said they can't have bananas or they have to have something, that means that's for me too. That's not the case. Really, you want to start looking at the foods that you enjoy and figuring out how you can include those in the diet or what you want to add to it to make it a more nutritious meal, a nutritious day, a nutritious life, because chronic kidney disease has no cure. So the diet changes that you're making are truly changes that you want to adapt for life.
All right. So I got another good question. Then we're going to jump in here because I see them starting to appear. So I go into all the social groups and I hear people talking about restrictions. I can't have this. I can't have that. I can only drink this little bit. Who or when should I start restricting? Who's going to let me know that?
Really, it's going to come from your own registered dietitian, sometimes the doctors, but I will say nephrologists, physicians, they have a lot to cover. They have a lot of things to go through. And nutrition is a really, really big topic. And they don't have a ton of training or education behind that compared to dietitians who spend literally years, their career, their education, all going through nutrition. So dietitians truly are the nutrition experts. So if you want to learn about limiting things or knowing when that's important to you, working with a dietitian, they're going to help go through your labs and talk with you about what you should be careful of. But a lot of times what we see, especially in plant-powered kidneys, we see a lot of people that talk about restricting things early on, thinking that like a low potassium diet is something that's really important, when actually potassium is very important to protect kidney function. And it's
And your
not something
heart.
yeah, it's and our heart. It's not something that you want to try to limit or avoid unless you are given very specific directions on avoiding it. And then, even so, it's not necessarily a forever type of plan. It can change because a lot of times it's based off of your labs.
Yep, I use that road analogy. I look at my future as a road, my diet as a road, my health as a road, and sometimes you get too much of something. Say it was potassium, that's a little speed bump. So I need to adjust my diet, reduce my potassium to get that bump gone and get the road back smooth. I don't want to go so extreme that all of a sudden now I got a pothole because I've got a deficiency in it.
Mhm.
It's all that balancing act. And once I understood that, whoo, it made eating and keeping my kidneys happy so much easier.
Yeah, it really, really does. When you have a better understanding, it's not a guessing game of should I do this, should I not do this. You understand, you know what's guiding you, you know what to look for, you know how things kind of work together, which there are a lot of things that work together in a renal diet. And having that understanding, it really, it's that whole phrase, teach a man to fish versus feeding him a fish. It really comes down to that. You learn about what to look for and then how to apply it to yourself. And then it just really just clears
Oh
so
yeah.
much up.
Yep. All right. Now this question's a little bit technical, and I don't know if you'll be able to answer it or not. That's okay. But Carol asked, do you have any information, or can you talk a little bit about an elevated PTH level? What
Hmm.
does that mean?
Yeah. Oh, I love this. This is a great question. PTH, first of all, stands for parathyroid hormone. So a lot of people are familiar with the thyroid or the thyroid hormone, but we're talking about the parathyroid hormone, and it's actually coming from the parathyroid gland, which sits on top of your thyroid. So the thyroid's like a butterfly, and the parathyroid are four little dots, four little glands that sit on top of the thyroid. And it produces the hormone known as parathyroid hormone, PTH. Now, parathyroid hormone helps balance our calcium levels. And so, normally, if we need more calcium, the hormone will come out and it'll produce larger volumes of that hormone, which signals to the body we need to get more calcium. And then it will increase the calcium we absorb from our food. It will also look to our bones to pull maybe some calcium from our bones to help balance the calcium in our blood. So, that's what PTH normally does. Now, with kidney disease, one of the issues that comes from that can be elevated PTH, elevated parathyroid hormone levels. And those hormone levels tend to climb higher and higher. Now, I don't remember the normal value off the top of my head.
I'll look
It's
it
somewhere in
up.
like the 20s to 80s, I believe is where the range is. But I can tell you, with my dialysis patients, I had some dialysis patients with end stage kidney failure on dialysis for several years who had a PTH in the multiple thousands, a very high hormone level. And the challenge with the higher PTH is it's this hormone that's pumping out to say we need more calcium, even if the calcium in your blood is totally fine. It's not necessarily that you have low calcium levels, it's this disconnect with kidney disease. And what happens, one of the issues that I, as a dietitian, really get concerned about is with these high PTH levels, they're going to go hunt for calcium. Where is calcium stored in the body?
Bones.
In the bones. And when PTH activates the calcium to come out of the bones, it also brings out phosphorus.
Oh, yes.
These are like best friends, calcium and phosphorus. So when calcium comes out, phosphorus comes along too. So it can cause elevated phosphorus levels, and elevated phosphorus levels can also trigger the PTH to go higher as well. So it's kind of this vicious cycle of higher PTH levels causing higher phosphorus levels, causing higher PTH levels, and it can go back and forth. Now, there are prescription medications that nephrologists will prescribe, and I really want to emphasize prescribe, because the medication they prescribe is hormonal vitamin D, or active vitamin D. And this active vitamin D is it quiets down the parathyroid gland, and basically it says, hey, it's okay. We've got this under control. Vitamin D helps us with our calcium absorption. And it's saying, don't worry, we're here to help bring in more calcium. Everything's fine. And so it's important to know that this is hormonal vitamin D and not nutritional vitamin D. There's different types of vitamin D, the way that the body processes it. And so you don't just take over-the-counter vitamin D and get necessarily the same reaction. So the prescription that the doctor gives you that is hormonal vitamin D can reduce and control that PTH. But if your diet is high in phosphorus, and we've talked about it before, the sneaky phosphorus additives. If you have a lot of phosphorus additives, that is also going to really hinder the plan of lowering your PTH levels. So it's very, very important to be very mindful of your phosphorus sources in your diet if you are experiencing high PTH levels. And another thing of note is, in regards to the prescription from your doctor, you really want to maintain that communication, because the amount of the medication, the prescription, might need to change based off of where your PTH levels are coming out in the future. So the medication gets titrated, it gets changed based off of what those values become later down the road. So that's as much of in a nutshell as I can provide right now without spending all of our time on that. It is a very technical question, but it's a very important question, and something that a lot of people with later stages of CKD can experience.
You know, that's the first time ever on here that's been talked about. And it's
Really?
rare for us to have something new, either, from you or from one of the nephrologists or somebody. That's the very first time. And what a great explanation.
Well, thank you. It's honestly, I've talked so much in my lifetime about PTH and phosphorus and calcium and vitamin D and how they all work together. It was really drilled into me as a new dialysis dietitian.
Well, we're going to stay on the topic of phosphorus. Rachel has a question. She's looking for protein choices low in phosphorus. She says she's struggling with this.
Well, I don't think I would be answering this right if I didn't start with plant sources, because that is what we're about for Plant Powered Kidneys. We're all about focusing on plants in the diet. It's not to say that you can't have lower phosphorus animal protein sources, but we'll talk about the plants first. So the soy products, so we're talking about edamame, tofu, tempeh. These are plant protein rich sources. And the phosphorus that comes organically or naturally from these sources is very low absorbed. So the phosphorus absorbed from plants is like 30 to maybe 50% that's coming from it. So the challenging part with this, I will add, is let's say you use like Cronometer or MyFitnessPal or something and you're tracking it. These food trackers don't have the technology, because the research is even still pretty new, to say, oh, well, you ate 100 milligrams of phosphorus, but it only absorbed about 50%. So you actually only consumed about 50 milligrams of phosphorus. The technology is not there. The data is not embedded into those systems yet. So you kind of have to, that's where it goes back to label reading. And as long as you can guarantee that the foods that you're eating don't have phosphate additives, you can definitely know that whatever the milligrams is listed for your food tracker, it's only going to be a fraction of what it actually says. I have some clients that will have phosphorus intakes into like 1800s or so, and that's considered high phosphorus, but it's all coming from plants. So I know it's actually only about 900 milligrams of phosphorus that they're consuming, that their body's actually taking in. So soy, tofu, edamame, fantastic protein sources. I would definitely go to those. And don't forget about your vegetables and your whole grains, because these actually do include quite a bit of protein. One of my clients, we were just talking today about the protein in her diet, and she had made a goal to actually eat more potassium. That was one of the things we were focusing on for her. And her protein intake went up on average about 5 grams per day, just by adding a serving or 2 servings of vegetables to her day. So protein is in plant sources. It's in vegetables. Like peas are a great source. There's protein in avocados even. So keep that in mind. Adding more plants to your diet, you can still add protein. If you want to add animal protein to your meals, if that's something that fits in your diet and that's something that is important to you and you understand the pros and cons with that, just make sure there's no added phosphates. That again is really, really the important thing, is that there's no ingredients that include PHOS. And if you buy things at like the butcher counter, you can ask them if there's been any injections, but I'll tell you, they don't always know. And I've asked this in the past for some butcher counters, and you might see like on the label at the butcher counter, it'll say like with injected solution or something. Or if it says like from frozen, like frozen shrimp, I don't think I've yet found a frozen shrimp that doesn't have added phosphates. So check your meat sources and really ultimately make sure that you don't have added phosphates, and because that is going to be the biggest like trigger or tripwire into having elevated phosphorus levels.
And I see someone, I was just about to add this. I love like edamame. Oh, I could eat it like popcorn, but
Yeah.
I see we have somebody in the audience who is just like me, that has an allergy to soy, which I discovered late. I actually discovered after my diagnosis with kidney disease. We were trying to figure out why I was having so much inflammation issues. And I was like, oh, I'm eating healthy. I'm eating lots of edamame and all these other great things. And we did some tests and discovered I had an allergy to soy.
What a bummer. Well, fortunately, there are a lot of other alternatives. Actually, in a dietitian group, we were just talking about a pumpkin seed tofu alternative called PumFu. And they use pumpkin seeds, and they go through a lot of work that they go through at their factory and turn it into a block of tofu or soy free tofu, basically. So that can be an option. There's a lot of things out there. So nuts and seeds can be great. I see someone says chickpeas. Yeah, beans, legumes, anything like that. If it's good for you, if it's something that you're not allergic to, then that can definitely be something to include. We typically get, when I say we, I mean in the standard American diet, we typically get a lot more protein than is necessary. And this is especially the case to be mindful of when it comes to protecting kidney health, because a lower protein diet can be more powerful in protecting residual kidney function. I'm talking about people not on dialysis. On dialysis, a higher protein diet is important because of the process of dialysis, of removing proteins from the body that need to be replaced. So this is one of those examples where it's like not everybody should be following the same renal diet, because they can be very, very different.
Yep, very good. And here's an easy question. You answered it, but I'm going to pop it up here again so we can make sure Joyce gets the answer. Where could you find an app to help her figure out phosphorus in food? Because it's not listed on all those labels.
Yeah. Well, our go-to is Cronometer. I think that they have such a great food tracker, and I know MyFitnessPal is another one, but they've put a little bit more behind their paywall, and it's just not as kidney focused. I think the opportunities that are on Cronometer, even the free plan. I mean, I do think their gold plan is fabulous, and it's very, very affordable for what it provides. I mean, the gold plan shows you PRAL, which is a whole other talk, potential renal acid load. It talks about oxalates, it talks about sodium potassium ratio, and it talks about phosphorus. Again, they don't have the technology, the confirmed data, all that kind of stuff to look at individual absorption of food. So you're just going to get the flat, this is how much phosphorus is in a certain food, but it does include your phosphorus, and you can track it, and you can see the higher culprits. You can see the foods that are providing more. But I think it's a really great one.
All right, here's one from Storm Vet. Can dehydration cause your GFR to decline 20%?
As far as like a specific number, I can't say for sure, but dehydration can definitely have an impact on your labs. So it's very, very important to be adequately hydrated. And you don't want to be guzzling a ton of water right before your labs, because that's not really going to give you good insight either. But just maintaining adequate hydration in the days leading up to your labs is really, really important. One of the things that I recommend to my clients is when they know that they're going to have a lab draw come up, we talk about really tracking their food and their water, even their bowel movements. We do a lot of tracking in the days leading up to their labs, because that's going to give us really good insight on what those lab values actually mean. So tracking and staying hydrated in those days leading up, very, very important.
All right, here's one you'll get a kick out of. It's a comment, not a question. From Manda. She says her nephrologist told her that diet doesn't really make a big difference in the long run, and she was floored.
I know. Honestly, I still hear this. I still hear this to this day. I even sat in a presentation, and the doctor on the stage said it floored me, absolutely floored me. What I can say is we at Plant Powered Kidneys see improvements from diet every single day. We see it in our students and with our clients. We see people email us and tell us, just by reading what we have to offer on our website, they're learning and they're able to find ways to add more plants into their diet. We know that it can make a really big difference. I think sometimes nephrologists, because they don't know nutrition, because they don't take that time to look into that with their patients, they just don't know. And it's hard. It's hard to hear that, because it's not necessarily the case. But what I do advise a lot of people to do is shop around for nephrologists if you do want to look for one that does believe in a diet making a difference. I think that can be really, really helpful, because, or if they're not interested in talking with you at all about the diet, asking for a referral to a dietitian. And if they still say, no, diet doesn't matter, then you say, okay, can you just write that down in the note for today and then print that for me so I can have a copy of you denying my request? And
Awesome.
you watch them change their tune, because they'll be like, oh, okay, well, if we're going to put it in writing, but you can, it's your health, and it's you're in charge. I mean, doctors do have a bit of a power dynamic, but at the end of the day, with all the recommendations, with the medications, with supplements, with diet, all of it, it's all up to you on what you decide to do. And at the end of the day, what matters is what you want to do. So if you want to talk with another nephrologist, see if there's others that are available that do have more of a holistic mentality about being at least supportive of diet changes. And sometimes just opening up that conversation can be really helpful, because I had somebody say, oh, well, it was not that my doctor didn't believe it or didn't support it. They just didn't know about it. And so maybe just, again, continuing to open up that conversation and say, well, I'm interested in making diet changes, and I would really appreciate it if we could do maybe a lab redraw in 3 months so I can see if I'm on the right track and see if they're agreeable to that at least. But working with a dietitian, you're going to hear how you can make a really big difference with your diet, regardless of where you're at, regardless of what you've done. A dietitian can kind of help clear the weeds for you and help show you some of those like areas of opportunity that you have in protecting your kidney function.
Yeah. And to build on top of that, first of all, I believe 100%, I have the evidence, my own experience, diet matters. And not only can a dietitian or eating healthy, a dietitian helps you make those right decisions, gives you the tools you need so you feel comfortable and confident in making good decisions. Not only do they help you, stop losing kidney function, help you maybe gain some kidney function, but they stop you from doing bad things that are going to accelerate the decline of kidney function. So there's so much goodness in working with a dietitian. I just could not imagine a doctor saying, it doesn't matter.
Yeah, I think it's
I've
just that
seen
they
it.
just don't know. I have to. I hear it a lot, and all I can say is, well, you can ask for another nephrologist. It's your healthcare. It's still a business, and you are a customer. You are a client of theirs, and if you are not satisfied with what they're saying, then you have the right to go to another healthcare provider.
Yep. All right. So we are almost at the end of our show. I know everybody's will be like, oh, James, it's only half an hour tonight. Jen and I both have something coming up at 7:30, so we have to end tonight. But Philip asked about that pumpkin tofu, and I'm definitely going to look into that. He's concerned since it's overly it's processed, is that going to be an issue? And I'm guessing they're not adding lots of sodium and things that make processed foods really bad.
Yeah, there's definitely, processing is such a big term in the food industry. Putting apples into a bag and selling it as a bag of apples is considered processing. They are changing the way the food is coming to you. If they are cutting up fruit and putting it in a container, if they're chopping up veggies and putting that in a container, that's processed food. So just be careful about the all or nothing idea of like, oh, I can't have processed food. That's not real life. That's not realistic. Things that are in our pantry are considered processed foods. Things that are in a box like pastas are processed foods. But be, I would say, a little bit mindful about like the ingredients, looking at what the product is. So in this example, they're just using really cool food science to create something that is helpful for people with a soy allergy. So if it turns into like maybe the pumpkin tofu is maybe it's like pre-seasoned and then battered and then fried and all this, like, yeah, maybe that's not going to be the best choice. But if it comes just as the pumpkin seeds in water, it's not going to be a bad choice. It doesn't have added salt. It's just the pumpkin seeds, and they made a really cool change to it to allow us to try something different with it. So looking at the ingredient list to see exactly what has been added to it or not added, and then using your judgment on, okay, is this something that I could include from time to time? Chances are yes, even processed foods. We do, again, like I think I've already said it tonight, like 50 times to avoid phosphate additives, but that's really one of the big things when we're looking at processed foods. But otherwise, if it's something that you enjoy and you've reviewed the nutrition and you feel good about it, then let's talk about adding more food into the diet.
Yeah, and I look for sodium because that's a big thing. I keep my blood pressure under control, and I look for phosphorus additives, PHOS, phos. I look for that, and if I see either of them, that too much of either of them, I just skip it. But if there's not, I'm okay with it, and it's worked for me. We are now at the top of our hour or half hour. This has been great. We got a lot of great questions, and I learned a lot about PTH, parathyroid hormone. Yay!
Yeah. Yeah.
So I'd like to thank you, Jen, for being here again tonight, taking the time to answer all these questions. It was wonderful. Jen will be back next month. We're going to do this every single month, a live Q&A. So you can jump on in, get lots of great information. You're hearing it from someone who knows what she's talking about. Be careful out there. I saw some questions. People are asking about certain things. They're being pushed around the internet as fixes and cures. They're not. They could even be dangerous. Work with your doctor. Work with a dietitian. That's where you're going to get the information that's going to actually help you slow the progression of your kidney disease, help you live better, help you live longer. All right, everybody. Thank you so much, and I'll see you all in the next video. Bye, everyone.